Thanks very much, Jody. It's good to be with you all again. It seems like every time we come back to meet with you, there's something new on the horizon, which I guess is the point of having a press conference. So we're glad you're here today. Look forward to answering your questions as we go on as well near the end. And if I could just go to the first slide, we'll get right to it. Also really happy to have Laura and Katrina here today. I think you all know that Dr. Perron was our real one of our strongest leaders during the pandemic when it came to vaccines. And Katrina Hochram-Lopez, Secretary of Aging and Long-Term Services Department, has been hard at it, protecting our seniors from COVID since before day one of the pandemic. So on the first slide here, you can see on the left that epi curve that you're now all used to. The good news is that black line way over to the right now just dropped below the red line. We still have some data to fill in. We've got that gray box that we always have there. There may be some more test results coming in. It looks like we are getting over the BA5 hump at the present time, about 90% of cases being BA5. We're also, as you all know, much more reliant and connected to the CDC now with data. And so this is one of the references we make to the CDC data that we look at every week. This is community levels. And that again is based on cases and hospital capacity. And you can see here that the state looks pretty green. Green is good. A few yellow counties with a little bit tighter hospital capacity or higher number of cases. But great progress as we come down off this latest wave. I think one of the things to just always remind ourselves is the thing that's really the most different about the wave that goes from May to September is we're probably only seeing about a quarter of the cases of COVID because people are testing at home and those home tests aren't fully reported in. We have a very small percent of people who report the tests and those self-reported tests don't meet CDC criteria for formal reporting. So I always, when I look at this little mound on the right that looks like the smallest, I make it 4 times higher than it is. And I think that's a better representation of what we've been seeing. And going to the next slide, really good news in hospitals, only 84 people in the hospital this morning with COVID. And you can see that's the lowest we've been since mid-May. So great progress there. And only 6 people on ventilators for a ventilator rate of 7.1%. And while we don't have a graph of the ratio, one thing that we know is that this strain, the BA5 strain of COVID, it seems much less lethal than previous strains, much lower mortality rate. And you can see total deaths of now approaching the 8,500 mark. We still have people dying almost every day from COVID in our state. There still are many vulnerable New Mexicans that we need to take into our consideration as we make our own personal decisions for ourselves, based on ourselves, our families, our risk factors, but also broadening that to the community. Next slide, please. More good news.
Recording in progress.
More good news is that we have a new definition from the CDC of up to date. It's really simple. I'm going to walk through it with you really quickly, and then I'll confess something to you. So you are up to date on your COVID vaccines if, number one, you had the primary series, those first one or 2 shots, depending on the brand of vaccine you got, and you've had the most recent booster. So let's practice. I had the primary series in December of 2020. I had a booster in October, I believe it was, of 2021. I had a booster in April of 2022. Am I up to date? And I know your microphone's not on, so I'll just give you the answer. No, I'm not. In order for me to be up to date now, I need to get the new Omicron booster that's recently been released. And so going forward, we're going to start reporting primarily primary series completed and up to date, which gives us a much better picture about community immunity. And while the traditional booster vaccines provided some protection, from against hospitalization and death. That's waned over time to the point now that the CDC and the FDA no longer recommend the original Pfizer and Moderna shots as boosters anymore. So we're not to give those to people. We're supposed to go with the new Omicron booster. Now, those of you who've been attending these press conferences for 2.5 years, remember that we actually started talking about this idea in I think the summer and fall of 2020, before the first vaccine is out. And while the jury is still out on this, I think we're seeing some movement to what we talked about back then, to more of a flu shot-like approach to the coronavirus going forward, where hopefully we get an annual booster. So similarities include the fact that this new booster for Omicron is patterned and made off of Omicron B5, which is far and away the prevailing strain in New Mexico right now, very much like the flu shot, where we take experience in the Southern Hemisphere in Australia and use that because it's their winter there now. They're just getting into spring to predict which flu strains are coming. Second thing, since I mentioned it, is you can, and I would recommend that you do, this is my plan, get both the flu vaccine and the COVID-19 booster, Omicron booster at the same time. Just save yourself a trip. We anticipate our pharmacies will continue to be the #1 distributor of these vaccines, with public health offices and our provider network, private office practices, and large group practices being close behind as well. So that's what you need to know. Next slide here is just a little bit more on the booster. I already mentioned most of this. Couple little rules. If you just got a booster a month ago, you're not eligible. You're actually up to date. Well, no, you're not up to date. Sorry about that. You just got a shot of the traditional vaccines 30 days ago. You're not up to date by the definition, but you can't get the new booster for a full 60 days. So you need to wait 60 days. And if you're going to get Pfizer, anybody over 12 or older can get Pfizer. Moderna is 18 and over, and you can still sign up online. You can go through directly to your pharmacist, to your provider, and there's a phone number here. On the right, I have a copy of the second to last page of the new public health order that was issued in August. And Dr. Perron and I had the incredible honor of spending an hour with Dr. Rochelle Walensky, who's the director of the CDC. And we sort of trotted out this public health order, and we said what a wonderful thing it was for our state to be able to now point people to CDC resources. And so I know probably all of you didn't read the public health order, but we pointed our healthcare facilities to the CDC website about hospital and healthcare workers. We pointed all New Mexicans to that little map about or all high-risk New Mexicans and their families and their communities to look at the website about people who need extra precautions. We pointed all New Mexicans to the QAnon calculator. Businesses, we now have CDC resources and a consolidated federal strategy. And we just told her how delighted we were to be able to join forces and have this be our public health report. She also thanked New Mexico for being one of the most consistent and reliable data submitters to the CDC. And so now when we point you to the CDC website, it's because we know that they have all of our data and they're publishing it accurately. So that was a great moment. She's a great leader. We learned a lot from her. She was really interested in some of our graphs, and we're going to send her more on that as well soon. Next slide, please. And now I'm going to turn it over to Secretary Hotram Lopez from Aging and Long-Term Services, because as you know, our older populations remain the most vulnerable population in New Mexico. And so as we roll out this new booster, while we don't have specific requirements anymore for hospitals or public, like state employees and people like that, we are undertaking a very aggressive effort to make sure that every senior, particularly in an assisted living facility and nursing home, has the opportunity to be vaccinated. So Katrina, take it away.
Thank you so much, David. And I'm so honored to be part of this today because it's good news. You know, our numbers are getting lower, and our residents in long-term care facilities and out in the community are feeling safer, and we're all getting back to a normal. So with that, next slide, please. The goal, we are actively looking at how we can get shots in arms in long-term care facilities, which include nursing facilities as well as assisted living facilities. We have begun the rollout. We have contacted many of the facilities. We've got a couple of providers on with teams and experts to go and administer the vaccines. We are using 2 pharmacy providers, and at the same time, we are going to be offering the flu vaccine as well, and so that they can be fully vaccinated and fully boosted or current with their boosters as we continue with this. And so we're excited to be able to do that, and we are excited with our partnership with the Department of Health, who is making sure that we've got enough vaccines in order to administer first in long-term care facilities. So senior centers are another area that we're working on simultaneously, and so we are working with our senior center partners, and we are going to get clinics scheduled, drive-through clinics scheduled again. So we are in the process of coordinating that as well. You do not have to be a member of a senior center to participate in this vaccine program. All you need to do is register and show up. And if you're having any problems registering, please call our number 1-800-432-2080, and we will get a schedule done for you in the particular area that we are going to have at our senior centers in order for you to be vaccinated. So we have 236 assisted living facilities and 67 nursing facilities. We also have over 200 senior sites. We will be focusing primarily or initially in rural areas with our senior centers to make sure that they are vaccinated and up to date. And then we will work in more of the metro area where there seems to be more access than in our rural and remote areas. Next slide, please. New regulations require that staff and residents need to be offered and continually educated on the vaccine. So if you or your loved one have not been educated and you do not know about this and you would like information on it, please let us know. Please reach out to us, 1-800-432-2080, or reach the Long-Term Care Ombudsman Program directly at 1-866-451-2901. We plan to have our rollout in long-term care facilities completed within 6 weeks, and then we will have continual events at senior centers and for the public until the numbers die down and we're not needed to do those mass events anymore. So thank you so much for letting me present an update today. It's really good news for our seniors all around the state of New Mexico. And I would just like to thank both David Scrace and Governor Michelle Lujan Grisham for all of their support and their push on COVID and COVID vaccinations. So back to you, David. Thank you.
Thanks, Katrina. And thanks for all your hard work. Katrina and I have had many meetings before 8 o'clock together during some of the tougher times of the pandemic. Now we started at 8, but really appreciate all you're doing and continue to do. So thank you. Now I'm going to turn it over to, if we go to the next slide, to Laura, who's going to tell us about new infectious diseases, first with a monkeypox update, and then with information about West Nile virus, and which we're seeing now in New Mexico. And finally, with information about polio virus, which we are not yet seeing in New Mexico, but has been seen here in the United States. And Laura, take it away.
All right, thank you so much. Okay, so monkeypox update. As you can see here, the monkeypox cases in the US and New Mexico here on the right-hand side. We have 22,774 cases in the US, but only 33 cases in New Mexico as of September 14th. As you may know from the last press conference, monkeypox is a viral infection in the same family as smallpox, but unlike smallpox, it usually doesn't cause serious illness. However, the monkeypox can result in painful lesions or sores, but rarely results in hospitalizations or deaths. So only one death so far in the US, so not very common effect of monkeypox. The monkeypox virus spreads through close physical contact between two people. And just want to remind people, anybody who comes in contact with someone else who has monkeypox with the monkeypox lesions can get monkeypox regardless of their sexual orientation, gender, or gender identity. Next slide. So far, monkeypox vaccines have been administered here in New Mexico, thanks to a lot of people in the states, but primarily in the state, primarily our vaccine team has given a lot of vaccines. So first doses, 1,749 doses have been given, and the second dose, 179. And really great work by the immunization team. So thanks to them for getting the monkeypox doses out. Next slide. A lot of people have been asking about the New Mexico monkeypox cases data. So far, there are 34 state total reported cases from the start of the outbreak to now in September 14th. So the locations that we primarily see it's primarily in the cities. So in New Mexico, it's been in Bernalillo County, 22 of them, Santa Fe County, and then the other individual counties are too small to count in terms of we don't want to share information that would put someone's individual health information at risk. So we have 21% in the rest of the counties. We've only had one hospitalization to date and no deaths to date so far. You can see the New Mexico monkeypox cases by age range here. You can see they're mostly in the 20 to 30-year-old age group and 31 to 40-year-old age group. Next slide. If you look at the New Mexico monkeypox cases data as well for types of gender that people have who have gotten monkeypox, there's a total of 33. And once again, if there's not enough cases, if there's very small number of cases, we don't report that. So mostly have been in cases in males. In terms of race, primarily in white, although, American Indian, Asian, or African American ethnicities can still get it, race can get it. It's just that we don't have as many cases here. But around the United States, it's actually kind of equalizing between the different racial groups. And then ethnicity, Hispanic or Latino, we've had 14 cases, and non-Hispanic Latino 17 cases for a state total, once again, of 33. Next slide. Okay, so we have more illnesses that are being seen in the United States, none in New Mexico so far, but a polio case was identified in New York State. There have really been no polio there for 10 years. But someone who's an unvaccinated man was infected by polio in Rockland County, New York. The vaccination rate in that county was low compared to the rest of the state. It was 60% compared to 79% for the rest of New York. And they also found it in the wastewater. The importance of that is that polio, we thought we had mostly eradicated it in the United States, but if we're not vaccinated, polio, which mostly affects children, can actually cause 1 out of 200 children to become paralyzed, and 8 will suffer from viral meningitis. And then out of 200 kids, 191 would just have minor symptoms. But we don't want to have kids become paralyzed for a disease that we can actually prevent. Next slide. So the best protection against polio and spread of polio is to be fully vaccinated. Good news for New Mexico. So thank you all the people out there who get their kids vaccinated and protect them. We ranked number 7 for polio vaccine coverage in the US. The bad news is vaccine kind of dropped off during the pandemic. And so we're encouraging everyone to get vaccinated. As you can see on our county map to the right, you can see that for kids who are 6 years old and have gotten their full 4 doses, it varies throughout the state. And so you can see some of the counties in our state actually have 60% or lower. So that would put you at risk if you didn't get vaccinated for the vaccine. Now, if you didn't get vaccinated as a kid, you can still actually get vaccinated as an adult. So it's a good time to get vaccinated against polio. Next slide. Okay, so for another illness that we have in our state, West Nile virus is now in New Mexico. We usually have cases every year. It's the leading cause of mosquito-borne disease in the United States, and it's mostly spread by getting bitten by an infected mosquito. So far, you can see here there's 3 cases of human cases here in New Mexico and 1 animal case. Next slide. And so symptoms of West Nile virus and how to protect yourselves, that's important. So if you get symptoms, you've been bitten by a mosquito, you get fever, headache, body aches, vomiting, diarrhea, fatigue, or skin rash. It's not that common, but mostly people who are older and have underlying conditions can actually get West Nile virus. So what you want to do is protect yourself no matter where you're at. These mosquitoes bite mostly from the evening to the morning. So you can use mosquito repellent when you go outside, wear a long sleeve t-shirt and long pants when you're outside, when it is mosquito season, like right now. And then also if you have any standing water in your house, you want to drain anything that holds water, like buckets or pet bowls, anything like that. Drain it, make sure you drain them twice a week so that the mosquitoes won't breed. Next slide. And then now I'm going to turn it over to David, and thanks so much for having me on to share about all the things that are going on with illnesses in New Mexico.
Thanks again, Laura. Appreciate those updates. And now we're going to take, and sort of pun intended, a deeper dive into wastewater monitoring. We've touched on this in the past. I think last year at this time, we were working on this, and we've come a long way. And so I wanted to let you know, maybe we can go on to the next slide first, but let you know that we have an increasing number of locations where we're doing wastewater testing. So these are, the way it works is the cities on this map, and there are 4 others that actually send their data to the CDC, including Albuquerque. And then we're going to be getting the data back from the CDC soon. So they'll be able to provide an even broader sample. But each week we add a couple more municipalities and towns that are sampling from their waste treatment facilities, the water, and they're sent to the state lab where Dr. Edwards and his team analyze it and do basically a PCR test on the effluent to see the number of copies of COVID in the wastewater. Now, this is kind of like a PCR test in the nose, where if it can be positive and you're having symptoms, and you'll have a positive test. But remember, way back in the summer of 2020, when we were learning that there were some people who still had dead viral particles in their nose. It's more like that. And so COVID sets up shop in the gastrointestinal tract. It continues to be shed, sometimes for months. There's some theories that perhaps long COVID is related to the colonization of COVID in the GI tract in a chronic fashion, although that jury is obviously still out in that. And then the other thing, though, that I want to say that I'm more excited about is not setting up wastewater testing for COVID right now, but it's the idea that we can test for polio and other viral infections, influenza, and other things to get, we hope, an early warning of impending outbreaks. And so we post that data online every week. It's updated on Monday. There are 11 wastewater systems participating. The data isn't particularly robust when you only have a week or 2 worth of data. In a minute, I'm going to show you an example from Rio Rancho, which is one of the earliest testing sites. And I'm going to show you how we're looking at it and how we're thinking about it. It's too early to draw conclusions and our data scientists are educating us. We spent a lot of time this morning taking a deeper dive into this to understand how to literally make this apples to apples comparison, because the number of viral particles, not infectious, but viral particles in Rio Rancho water system is going to be much higher than Clovis, all other things being equal, because there's so many more people. So we're working on smoothing out those numbers and figuring out the best way to report. But the next slide will show you Rio Rancho. And so let me just orient you. We've got the sample collection date that goes back to May 4th. And you can see they're collecting more than once a week, actually, for this. And the blue line is the number of copies per liter. Now, this is on a logarithmic scale, so the lines aren't linear. They're spaced a factor of 10. So it goes from 100 to 1,000 to 10,000 to 100,000. That helps smooth out some of the, because if you look at these counts, they're very jagged up and down every day on a regular scale. And so the blue is what we're getting from the wastewater. And then the dotted gray line with the gray dots, that is the number of cases per day. So the cases are on that, are measured on that right y-axis, and the viral copies on the left. And what we're looking for here, and I picked this example to kind of illustrate this, but they don't all show it yet. So we have to refine our data anymore. But what we're looking for is to the extreme right, and Brianna will probably point to it, but you can see, sorry, extreme left, the other right, Brianna, sorry. You can see that we have a higher level of COVID cases before we have, a higher level of counts in the wastewater of COVID particles than we have cases. And it sort of predates the rise in cases by a couple weeks. Now, that's what we're hoping to find, not just for COVID, but for things like polio, where we can start monitoring systems. And for example, we can say, hey, Rio Rancho, in this example, back on May 4th, it looks like an uptick in the number of virus particles that we're finding in your sewage system. You may want to brace yourself or take extra precautions for a coming wave. Now, just to head this off at the past, other reporters will say, well, if it's so good at predicting, then why does it stay high back in, on the right side of the graph? The viral particles in the wastewater are really high and cases are dropping. And so I don't have an answer for you that today. We did talk about the fact that this will persist in people's, the COVID particles will persist in the GI tract for a longer period of time than the active infection. And so we're still learning, we're still figuring this out. We're experimenting with like copies per day per 1,000 people in a county to see if we can level this data. But this is sort of a preview of coming attractions. And we're hoping CDC currently isn't funding states to monitor polio and things like that, because it does require significant funding to bring up that capacity. But we are hoping that we'll start to see, as we see some of these outbreaks, new sort of scientific breakthroughs in how can we monitor things and getting 2 weeks ahead would be great for any disease, not just COVID. So next slide, please. I think with that, I just wanted to put on my Secretary of Human Services hat for just a minute. We've been on this hiatus during the pandemic for just keeping everyone on SNAP and Medicaid and some of our other programs during the pandemic. But the rules and the statutes, the national laws that govern SNAP are different than the ones for Medicaid. And so while Medicaid is still connected to the National Public Health Emergency, SNAP no longer is. And what that means in New Mexico, we've had some extensions due to fires and floods, but what that means is that in October, 494,620 existing SNAP customers will begin a process of recertifying. Now, not all of them will become due in October, but that's a lot of people, a lot of your readers, viewers, listeners. And so we really hope you'll help us get the word out that SNAP renewals start in October, and people really need to look out for text messages and for letters in the mail, reminding that 1/12 of these people that they are now up for recertification. Actually, it's higher than 1/12. It's about 50 to 60,000 people. So everyone in New Mexico is on SNAP. A quarter of our population needs to be aware that now they have to stop renewing. We strongly encourage anybody with a computer or a phone to go on and do that work online. It's faster. We will be able to process your SNAP renewal much faster because all of the data is already in the system. We don't have to manually enter it, but we also are aware that not everybody has internet coverage where they live in New Mexico, and not everyone has a computer or a phone that they can use to do this. And so there's a way to mail in these applications and also show up in person at one of our offices that we have all over the state to have your application processed. Really important, a quarter of our population. We don't want anyone to go hungry. Also, benefits in the near future will start changing as well. So people who've had the same level of benefit for the past 2.5 years may see a decrease in that according to federal law as well. And we're happy to help explain that to you and go through that with you as well. So that's a message from HSD. I'll put my HSD hat on again, probably every month to give you updates on this, but also in January or February when we think this is going to start for Medicaid, where we have almost half of our state's population, 46% on Medicaid. We'll be back to you with alerts about that as well. And then I think we only have one more slide, and it's just our usual wrap up. Please know the community level for COVID-19 where you live from the CDC website. They have guidance for low, medium, and high levels. That guidance varies. We're really hoping that everyone will get back up to date. When we start reporting the number of people who are up to date soon, it's going to be very low. It will probably be lower than 10%. Someone asked the question, well, is the drop in cases we're seeing due to the new Omicron booster? And I would love to say yes, but the answer is no, because we're just starting to get the Omicron booster out into the field, and it's too early for that to be a significant factor in reducing cases. But 2 months from now, we're figuring it will. So I'm hoping that the Omicron booster actually keeps cases down going forward, since we're getting down to lower levels. Getting vaccinated is important. So let's all get up to date. I'm going to be scheduling my shot soon. Please join me in doing that. Get tested immediately when you have symptoms. Get treatment if you have a positive test, a symptom, and one risk factor or more. You should talk to your provider about getting tested. And then masks, we have better masks, and I'm still wearing mine. I see patients 4 days from now, and so I'm back on my masking regimen for 7 days before I go back to the office and in almost every indoor setting. And so I vary my routine based on that as well. We all should be varying our routine based on what we know and how we can support coworkers, family members, and those we live with who have more risk than we do. And I think that's really it, Jody. And we're gonna, I'll send this back to you now, and we'll open it up for questions from our media partners. Thank you.
All right, so please raise your hand and I will call on our media partners for questions. I see Austin Fisher's hand raised. After Austin Fisher, we'll go to Chris McKee with KRQE. Austin, you're unmuted and you should be able to ask your question.
Hi, good afternoon. So my question is for Dr. Grace. So the Human Services Department and the Department of Health have closed all but one of the 27 COVID positive isolation shelters that the state was operating at the height of its response to the ongoing pandemic. A spokesperson for HHS tells me, quote, "Should the need arise, we will determine if reopening of shelters is necessary," unquote. What are the criteria that HHS and DOH will use to make that determination? And where would those criteria need to be for those shelters to be reopened?
Great question. And I can let you know, I think you're absolutely right. We've been actually opening and closing and opening shelters through the whole pandemic. The curve lags the case count curve by just a couple days to a week. But on our highest case counts, we've done the most sheltering, and the lowest case counts, we've had none. And it goes up and down. Typically for us, it's sort of a team-based decision, but typically in a given community, when we have people, the number one criteria for reopening a shelter is that we have one or more people who cannot isolate. And that's a particular issue. And I think New Mexico has done an amazing job. And I want to thank Angela Madrano, who's really led our sheltering effort for over the last year and a half, keeping track of these things and opening it and closing them, and working with community partners to sort of take the temperature of the community about whether that's needed. We need more sheltering in New Mexico because we have more multi-generational households. And we have a lot of smaller homes where we might have 2 or 3 generations of people, 6 or 8 people, and maybe only a couple bedrooms. And so we're really grateful to our partners at Buffalo Thunder and the Pewaukee Pueblo, because they've really provided a central location for sheltering Native Americans in their resort. They've been great about that. So we monitor cases. We monitor cases statewide, and we have actually documents about this that we've, our plans for opening and closing things. We don't have a hard metric, but generally, as soon as we are encountering one or more people who need sheltering, then we will contract with a hotel or reopen a contract that we have with a hotel for those people. If it gets to a big number, like we have to shelter 16 people, let's say, in a Super 8 motel in Albuquerque, to use one of our favorite examples, then we might actually rent out the whole floor or a whole wing of the hotel and just keep that on contract until we see case counts go down. So basically, it's case counts will predict the number of people who need sheltering generally for people who are unable to shelter on their own. Early on, we did that with healthcare workers. We sheltered them as well because we weren't sure about the infectiousness, but healthcare workers have gotten really good at protecting themselves and their families. And so while we do that occasionally, not as often. Also, one of our nursing homes, Canyon Nursing Home, is still open, and we use that as a step down for hospitals and also a place to put COVID positive individuals who can't shelter in place. And so Katrina works, Secretary Hotram Lopez works with that nursing home and the Genesis organization to modulate the size of that one as well. So it's another approach we take, but it is cases and the number of people. And we've actually reacted when there was a case, one person we couldn't shelter, we just buy a hotel room and then we see what the trend is and figure it out from there. Probably a longer answer than you needed, but that really is the answer. And we've been through many, many cycles of opening and closing since the beginning of the pandemic. Thanks.
Okay, next we'll go to Chris McKee from KRQE News. And after Chris, I'll read a question that's in the chat. And after that, we'll go to Julie Goldberg.
Hey there.
Chris, you should be able to ask your question. Yeah,
Okay.
I guess.
Thank you. I appreciate it. I wanted to check in on a little bit of what Dr. Scrace was talking about.
Chris, we just lost your audio.
Oh, okay. Am I back? You good?
You're back.
All right, great.
I thought you really just wanted to check in and that was it, but I
That's
guess
it.
you're probably
Just
going to
wanted
ask
to
a
say,
question.
Thanks. Hey, well, good to see y'all. I wanted to check in on some of the last things that Dr. Scrace, you were talking about. Once the numbers start maybe coming out about this latest COVID booster, your projection was it's probably going to be low. And along those lines, obviously we're in a different point here in 2022. I think when you just sort of broadly look across the United States, people are trying to move on with COVID, but continue to live with the virus. And with that, some dynamics change with how people think about the virus and whether or not they think that they should get this booster. And so I guess my question is along the lines of, what do you expect for New Mexicans? What do you expect the uptake to be in terms of maybe do you have a target percentage? I imagine 100 is probably always that, but, is there realistically some sort of number you're shooting for And does it concern you at all that maybe people are going to say, you know what, I've got enough. I don't think this is for me.
That's a great question, Chris. And Laura, I'm just going to put you on alert that I might come to you and see if the team has an internal number. I think we're in a transition, like we've been talking about for the past couple months, between the original shot and just getting more and more of it, and a new, hopefully, maybe we can get by with an annual vaccine. Although COVID, people are saying COVID is seasonal, but it's not seasonal like flu is seasonal yet. So we're in a transition. So in my head, I'm kind of hoping that that folks who get flu shots, which I don't know, I don't have the exact number, but I'm going to say 65% of New Mexicans are likely to get a flu shot. You know, most healthcare organizations require it, et cetera. But I'm hoping over a couple years, we can at least reach the level of flu shots. I'll also predict that seniors are more likely to take the new booster. They have much higher flu vaccine rates than the rest of our population, for good reason, because the mortality rate for COVID, for flu, is much, much higher in seniors. And so I think we're going to have to play it by ear. We have seen a declining interest in the vaccine as we added new age groups, and even a new vaccine came out, a new version, not big of an uptick. But I think I consider it the COVID vaccine for 2022. And I'm hoping that people will hear that message and be more likely to get it with their flu shot this year than not. Laura, I don't know if the team has set an internal target just yet, but what's the vaccine team thinking?
Yeah, we haven't said, well, our target is try to see if we can get to similar levels of boosters for seniors. Like you said, the senior, they are the most at risk, and people with underlying conditions. So if we can get close to what we had before with seniors, which was, Katrina, is that around 70 or 80% for seniors? That would be a very good goal to protect our most vulnerable population. But go ahead if you want to share that.
It was almost 80% it was actually over 80% in long-term care facilities, and under 80%, about 72 to 75% in terms of the community and our vaccination efforts.
Yeah, and I don't know. I mean, I think there's also the buzz part of it, and it's not data, but a lot of my patients now asking me electronically or in visits, like, hey, when should I get that new booster when it comes out? And the answer is yes. And I don't know, what are you hearing from nursing homes? Do you think that there's an interest among seniors in this that's pretty high, Katrina, or are they kind of bored with the whole vaccine routine?
No, this population is typically excited about vaccines because they were the ones that were confined in their rooms and with masks. And so we are pushing for the education and knowledge. I think that we can have a really good vaccination rate again. We're looking and targeting about 80% for our residents. And so we're pushing very hard to make sure that happens.
And I think, Chris, one of the things we learned through the first part of our vaccination effort was that the media plays a huge role in getting the word out, raising awareness, keeping this in front of people. And I think in the next couple months, we're going to see a lot more data come out. And I predict that this vaccine will have as dramatic an effect on our current strains, the Omicron strains, as the original vaccine did on the strains we had then in terms of reductions of cases, hospitalizations, and deaths. And so I think we're going to see those the vaccination report we put online return to the original days where being vaccinated, this time with the Omicron booster, your 1/20th is likely to be hospitalized or die than you were. But we don't know that for sure yet, but we'll know that in the coming months. We'd appreciate your partnership in getting that word out. Thanks.
All right, thanks, Chris. Next, we're going to go to Faith from KRQE 7. She's the reporter who put her question in the chat, and she would like to ask it live. Go ahead.
Hi, can you hear me?
We can hear you.
All right, awesome. Thank you. So I sent in a few questions via email, which you guys already answered. So I do thank you for that. But I was just curious in regards to last month's numbers for the monkeypox. It was reported that it was 10 cases, and health officials were saying that vaccines are only accessible by appointment, only if one has been infected with the virus or has come in contact with someone that has it. Does that still stand? And then also, are is that accurate? That's what I'm fact checking about. And then I remember having an interview with the Department of Health a couple of weeks ago. Not sure if you guys are able to touch base on this concerning the Omicron vaccine rollout. I was more so curious, how long does the vaccine last in one's body before they have to get another one? Will it be annual, like this specific vaccine for the Omicron?
Laura, do you want to start with both of those?
Yeah, sure. So for the Omicron vaccine booster, we're like David just said, we're thinking about it as probably a yearly. This Omicron booster was specifically made to address these particular variants, the BA4, BA5, and also, the previous COVID. So it's going to be tailored more specifically to you for this situation right now. So we're hoping it will last throughout the fall and winter. And then I think it's just like anything else throughout this whole COVID pandemic, if we don't get new variants, that hopefully will hold. If you start getting new variants, I think then there'll be a movement to, developing it just like how flu vaccines are developed as things mutate and change. So that's Omicron. In terms of, did I answer your question for Omicron booster?
Yeah, to some extent, but so just
Oh,
to make
okay.
sure we're on the same page, so I'm reporting it accurately. I know the specific vaccine is for the Omicron. So basically for that BA5, if there's no new variants, that person is okay. They don't have to continuously get it like every 6 months, every 1 year. It's standard. They're okay.
That's what we hope. It's just like anything else, though. Yes, I think and David, you can weigh in on this too, but if it just stays BA4 and BA5, then yes, this one is tailored to that to help boost your immunity. I think the other piece that you also have to remember is that there's waning immunity. So, after you get your vaccine, we have data showing that over time that immunity you have decreases. So you still may need a booster every year or every 6 months, depending on the data that we're seeing in the community.
Great. And then in regards to last month's numbers, can someone just verify that for last month? Was it reported 10 cases for the monkeypox? And do people still need to have an appointment to get that monkeypox vaccine if one has been affected with the virus or has come in contact with someone? Does that still stand, or they can just walk in any given time? Has that changed?
Okay, yes. Okay, so let me just say, yes, I believe last month it was 10. Now we have 33 cases of monkeypox. In terms of the vaccine, how you get it, if you believe you've been exposed to the monkeypox vaccine, you can monkeypox. If you believe you've been exposed to monkeypox, or then you can actually call our hotline, so that then they will go through a series of questions to determine, if you've been exposed, then you can get a vaccine. The other way to do it as well, though, is that if you're at high risk for monkeypox, and you can also call our hotline to see if you're at high risk for monkeypox, but basically people who've had contact with someone with monkeypox or in a high risk group, primarily men who have had sex with men, but also anybody who's had contact with someone with monkeypox is at risk. So we do want people to know, hey, if you're at risk, if you've had multiple sex partners in the past month or so, then you are at risk. So you should get a monkeypox vaccine. You can register online, or you can call our hotline and they'll ask you more questions to help you determine your risk and then whether to get the schedule for the vaccine.
So I think the quickest answer to the question is no, the vaccine is not limited only to people with monkeypox.
Correct.
Or their contacts. It's limited to people at high risk. It includes also
Includes.
people who are high risk. And I don't think there's any general need in the population for people who aren't at high risk to worry about it. Like, I'm not wondering when I'm going to get a monkeypox vaccine, for example, but we, as supplies increase, we'll continue to look at it. But right now, it seems like we have enough vaccine to meet the need of those who've been exposed and those who are at high risk because they're in a high risk group. So, Jody, what's our next question?
She has one more question. Is this the monkeypox vaccine by appointment only?
Oh, yeah.
And
Yeah, so so what you can actually, it's by appointments, a scheduled appointment. If you have been exposed, then you call our hotline or your provider will call us and we'll get you we'll get you right away.
okay, and so next we're going to go to Julia Goldberg with the Santa Fe Reporter. And after Julia, we'll go to Ryan Botel with the Albuquerque Journal. Julia, you should be unmuted.
Okay, thanks, Jody. Drs. Scrace and Petahone, I had a question about monkeypox, but could I really quickly, Dr. Scrace, just follow up on something you said and make sure I was understanding? It sounded as though you were talking about being glad that the state and its residents could rely on the CDC website for COVID data, but Dr. Walensky last month, in a sort of mea culpa about the CDC response, one of the things she cited as being problematic was CDC communication and said they're going to restructure the communications office and all their websites to make it clear. So I guess I'm just curious why that would be great to have people relying on a website the director thinks is confusing. And I mean, I know where to find everything, but it's not actually that easy to navigate. That's my question.
Yep. Okay. We actually talked to Director Walensky about that last week. She is really a delightful leader, and I was super honored to meet her. We talked a lot about data consolidation, and I think some of the challenges CDC has is related to all the states submit data, but they have not specified a defined format for how we submit that. So the data that you see for New Mexico on the CDC website is the same data we've been showing here. And I think and they just take it and put it with other data and put it in. The totals for the United States might not be everyone measuring it the same way as New Mexico. I have bookmarks on my computer for, of course, our epidemiology reports and, and a few DOH websites finding a test and treatments and things like that. But then the UpToDate, the new CDC UpToDate, site where you can, I forgot to mention this, but you can just go in and they'll ask you a bunch of questions and they'll tell you if you're up to date or not. It takes about 30 seconds. I did it this morning. I'm not up to date, but I will be soon. I also bookmarked the Q&I calculator that was down for a couple of weeks, and they did actually revise it to make it more user-friendly. And I think what they're doing and gravitating toward and what she was talking about is what some of the things we're starting to see now and things we put in the public health order, more easy to use tools for people to put in their own information and get an answer back. Should I quarantine? How long? What date do I start? When do I stop? Should I isolate because I have COVID now? Now, how do I do that? When can I go back to work? So I think we're seeing that progression. And I think it's just 2 points in time kind of question. But I use those bookmarks and I give them to people every day. One of the ones I mentioned and the same ones that are in the public health order. And we publish in the DOH and HSD offices every week the map of community levels and the map of community transmission, both on the same page, and put that up on our walls. And so I think we're relying increasingly more and more on what they are really doing, which is making it more user-friendly.
I see what you're saying about the 2 points in time. That makes sense. So the question I wanted to ask was last week, the CDC, their morbidity and mortality weekly report, they were looking at, I guess, a new survey of monkeypox cases. And they're finding that 40% had occurred in people with HIV. That had been that came from, I think, 8 different states that have external surveillance of HIV, and New Mexico was not listed as one of them. But I'm just curious if that is on your radar, or that stat is kind of holding up here as well. Anything you could tell me that correlates to that. Thanks.
Yeah, I'm going to turn that over to Laura, but I saw that article. It does make sense. I know a lot of our targeted information to vulnerable populations is aimed at and working in partnership with some of our larger clinics in New Mexico who focus on treating HIV patients. So I think we're ahead of the curve on that. But Laura, what else would you like to add?
Sorry, we have a great team for that here at DOH that does the prep and the support for HIV. And so all of our monkeypox cases and also the immunization sessions that we've had, we've offered that as well to people so that they can get, prep or other services at the same time. So thanks. Yeah, that's on our radar, and they've been really good about that, our team. Yeah. And yeah, a lot of people already on prep as well. In Mexico. New Mexico is a really good state for that.
Great. Okay, Jody's sort of letting us know we're running out of time, and we really want to make sure we answer the raised people who saw their hands raised. So I can stay a little late, Jody, and Laura and I will work on being even more brief than we can stand.
Thank you. I appreciate that. We need to move along. Thank you, Julia. Next, we're going to go to Ryan Botel with the Albuquerque Journal. Ryan, you're unmuted and should be able to ask your question.
Hi, everyone. Thanks for taking the time to talk with us. I wanted to clarify what is the recommendation right now for who gets the new COVID vaccine from the CDC and the Department of Health? Is the recommendation that basically everyone 12 and up get the one that they can? And what's the supply or just the supply and demand like in the state right now for that shot?
The recommendation, just to go over it again, is Pfizer, anyone over 12, Moderna, anyone over 11, 12 and older, Moderna, anyone over 17 or 18 and older. And you should be at least 2 months since your last vaccine, be it a primary series or a booster. And I think there's a debate, nobody's going to ask about this, but real quickly, Jody, there is some evidence that maybe if you just had COVID, like in the past couple of weeks, you might not want to get the booster right away, even though you're less than 60 days, or maybe some added immunity by waiting 45 to 90 days. And it was one study, we're waiting for more data on that. And then Laura, on demand so far, do you want to speak to that?
Yeah, so far there's been 7,000, there's been demand we have plenty of doses, and I think, let's see, let me just look it up. I think 7,000 and around a little bit above 7,000 doses that we've had so far.
That we've given?
That we've given, yeah.
And we have plenty of a supply in hand.
And we have plenty of supply right now, yeah.
Okay, thank you.
So yeah, hopefully you can get your shots in.
All right. Thank you, Ryan. Next, we're going to go to Jared with KUNM. After Jared, we'll go to Algernon Demacia from the Las Cruces Sun News. And finally, we'll close with an AP reporter. I don't know if it's Susan Montoya or Terry. Jared, just 1 second. You should be allowed to.
Right. I think I can be heard, I'm hoping. Thank you.
Yes, we can hear you. Thank you.
Jared from KUNM, and thank you, secretaries, for your time today. At last report, there had been something in the neighborhood of 30% staff vacancy rate in the Department of Health, and that included the state epidemiologist who had departed. Where is that at now? Do we have a new state epidemiologist in the pipeline, and do we have a new health equity communications officer also, especially given the health equity concerns that the department is attempting to place forefront? That would be one question. And then I just also want to ask, what is the state planning for long COVID? given the rampant transmission. The green map you show doesn't represent the actual transmission in the streets. The transmission in the streets, as you recognize, is much higher than what's shown. And so how is the state preparing for the inevitability of long COVID at this point?
I'll start off. We have 3,920 authorized positions, but we're budgeted for much less. So it depends on how you calculate the vacancy rate. If you calculate against authorized positions, it's 29%. If you calculate how many of the positions do we have money to fill, do we have filled, it's much lower. It's in the low 20s nationally. The numbers are about 30%. A lot of burnout occurred of public health workers during the pandemic, and so we've seen more attrition recently. We do have a state epidemiologist. It's Laura Parahone, Dr. Parahone. She's with us today. She's in an acting role, and we are still actively searching. That finding a state epidemiologist is a tough search, because of all the people who got burned out during the pandemic, probably state epidemiologists had some of the highest turnover rate. And so we're still looking, but we're really happy with the job Laura is doing, and feel really good about having her there. So we feel like we have that base covered right now. And then Laura, on the health equity communications position, can you speak to that?
Of
And
course,
why don't you
yes.
just keep yourself off mute? So
Okay, that's probably a good idea. Thank you. Yeah, so we do have actually a vaccine equity communications team. And currently we have a really awesome person who's working on our vaccine equity communications, Lisa Gonzalez. And she's our vaccine equity project coordinator, but doing a lot of the communications and working very closely with our really great marketing and also communications team here. So definitely keeping it in the forefront.
All right, thank you, Jared. I'm going to go now to Algernon Demacia. Algernon, you should be able to unmute yourself and ask your question.
And so it is. Hello. I just want to go back to a statement you made when you were discussing vaccinations for polio and other diseases, and that there was a trend over the pandemic that those had been coming down. And I'm wondering if that's attributable mainly to a period of time when schools were closed and other kinds of access issues, or whether something is shifting in terms of public confidence in vaccines.
That's a really good question. I think it's a combination of those things. I think that, we've been looking at over time that there's been some confidence issues just, regarding vaccines, but also the school, school not being in session. Also, usually that's when kids get their vaccines back to school, and also some access issues during the pandemic with people not maybe bringing their kids to the pediatrician's office. But, we are seeing that for adults, for some reason, that came back up. And our team is doing a lot of work now, working with our marketing team, working with back to school shots, and just encouraging people to get their vaccine. So, but we're doing pretty good overall, but we need to keep on encouraging people to get their vaccines, because, polio is scary. If you do get it, you could get paralyzed, and it's incurable. So you really want to get our kids vaccinated right now. And so I think that's where you guys come in, like just keep on sharing in the media everywhere, like, getting your vaccines, and then people trust their providers a lot. So any providers out there, just keep on, encouraging people to get vaccinated.
also, one last thing, and I noticed this, unfortunately, the very first time when I was seeing the slide at the press conference, but the last data point is only for the first 8 months of the year. And if vaccines were distributed 1/12 per month, which they're not, or you take that last number, divide it by 0.67 to correct, we'll actually be higher than we were 4 years ago. So I think that the not being in school, and you can't get your kid into school if they haven't completed their vaccination series, I think now that that's back in play, we're seeing a big uptick. And so we'll see what happens. I think schools are even now going through and looking through those records and reinforcing, and we're giving people, because they're behind and they need a series, giving them some time to catch up. But I think we've seen a surge already this year, and we'll see it further. And I don't think for childhood vaccines that particularly if the data goes up like I think it's going to, that wouldn't support the idea that people are just sort of tired of it or over it or no longer endorse them. But we'll know more at the end of the year. It's a great question. Thanks, Algernon.
Right. Our last question is going to be from the Associated Press. The name says Susan Montoya, but I think it's Terry. You should be allowed to unmute yourself.
Hi, can you hear me?
We can. It must be Terry.
This is Terry Tang with the AP. Thanks for having me. My question is there any indication that there'll be an end date to the current COVID public health order? Because I was just thinking about that because the governor of Washington State recently said, hey, we're going to end it. We're going to end all our orders on October 31st. And if there's no indication of that, what are the ideal conditions you want to see for that to happen?
Great question. Thanks for asking it. Say hi to Susan for us. I think in New Mexico, because we have the third lowest per capita income and low income people in New Mexico are so dependent on federal benefits, and the enhanced federal benefits that we're seeing now are dependent on maintaining a public health emergency, that there is very little likelihood that we will end our public health emergency before the federal government does. It would create a very, very difficult situation for, I think I told you we have I think we have 970,000 some people on Medicaid in our state. So we want to preserve those benefits that tie in to the federal public health emergency. And the way to do that is to maintain this one. I think you also correctly inferred that the current public health order doesn't have an end date. Unlike all of the others, we spent a lot of time in August consolidating everything, keeping just a small number of items from many, many public health orders. So we've really compacted it into a small number of interventions. But I would be stunned if we don't continue that. And I've had conversations with the governor, and she, I think, is in agreement with this, that we will continue the state's public health emergency at a minimum until the national public health emergency is no longer in place. Hope that makes sense, but there's hundreds of thousands of New Mexicans who would lose significant benefits were we to do that before the feds did. Thank you.
Thank you.
All right. That's all the questions I have from reporters who raised their hand. Dr. Scrace, if you have any last words, we can wrap this up. I just would like to announce right now, our next press conference is scheduled for October 6th. Dr. Scrace and Laura and Katrina, if you have any final words.
Katrina?
Certainly. So again, if you have trouble or you want to know where to schedule an appointment or get your booster, please call 1-800-432-2080. We can get that scheduled for you. And again, we are going to be in nursing homes and assisted living facilities. We should start our rollout next week. And the project should take around 6 weeks to complete. So, but that's it. And thank you all for joining.
Thank you. Yeah, thank you so much for all you're doing, Katrina, too, for all our seniors. And then I'm just really excited that, yeah, let's get out there, get our kids vaccinated, get our boosters, and protect ourselves as best we can right now. And I think it's exciting that we have a new booster shot and that we can be protected. So thanks.
And Laura, since she answered the question, has found that we've given 7,324 doses off of a supply that we have right now of 35,000 doses. So we're doing well there. I would just say, I think we're in a transition. I'm excited about the booster. I'm excited and have my fingers crossed. I can't say like some other people are saying that this is the new deal and it's going to last for a year, because COVID is still very, very not seasonal. I mean, some of our worst times have been during the summer. So I don't think we can say that quite yet, but we're in a transition. We have a lot of great tools, but we still need to protect vulnerable New Mexicans, protect ourselves and our families, and appreciate your support in this. COVID effort and getting the word out about the booster, and also just your interest. I mean, this is a great turnout for a press conference that, you know, we have as many people here today as we did 2 years ago. And that's great that you're still interested, that you're still getting the word out. And we're going to need your help on things like, in a different way, but monkeypox, West Nile, and God forbid polio as well as we move into the fall season. So thanks to all of you. Be safe. Wear your mask when it's appropriate to protect yourself and your family. And we will see you in early October. Bye-bye.